Breaking the Mold, a recent subanalysis of the LODO-CO2 trial, published in JACC and unveiled at ESC Congress 2025, reveals that daily consumption of low-dose colchicine might decelerate the expansion of blood mutations associated with diseases. But here's where it gets controversial. This study challenges conventional wisdom by suggesting that a medication primarily used for gout and inflammation could potentially offer benefits against genetic mutations linked to blood cancers and cardiovascular issues. And this is the part most people miss. It's not just about treating symptoms. It's about targeting the root cause of the problem. Let's dive into the specifics. Clonal hematopoiesis, CH, mutation in blood stem cells, is often found in older adults and is tied to an increased risk of developing leukemia and other blood malignancies. Moreover, it's connected to a more than 1.5-fold heightened risk of cardiovascular diseases, such as coronary heart disease, heart failure, and arrhythmias. The most prevalent driver genes responsible for CH are DNMT3A, TET2, and ASXL1, accounting for roughly 80% of CH instances. Studies indicate that over 10% of individuals aged 70 and above carry one or more of these mutations, with the likelihood increasing as they age. In this groundbreaking research, scientists focused on a subgroup of participants from the LODO-CO2 trial, which previously demonstrated that 0.5 milligrams of colchicine daily reduced the risk of cardiovascular disease by 31% in patients with chronic coronary disease. The aim? To ascertain if colchicine could also modify CH growth in these individuals. Participants contributed 4 blood samples at the outset of the study after 30 days, 1 year post-randomization, and at the conclusion of the study. Blood DNA sequencing detected and quantified CH mutations to monitor changes over time, and 2 inflammation markers were assessed at the initial 3 time points. Those assigned to colchicine experienced a non-significant 6.3% yearly rise in the total number of mutated CH cells, whereas those on placebo saw a significant 14.9% increase. Notably, colchicine notably slowed clonal growth, specifically in TET2-CH, with a 9.1% annual increase in TET2 clone size in the colchicine group versus a 29.6% increase in the placebo group. These outcomes are noteworthy due to the strong correlation between larger CH clones and both cardiovascular disease and cancer. Particularly, TET2-CH has been consistently linked to higher cardiovascular risks. Our study implies that individuals with CH, particularly those with TET2 mutated CH, might gain substantial advantages from colchicine, including reduced cardiovascular risk. According to Michael Honigberg, MD, MPP, FACC, a cardiologist at Massachusetts General Hospital and the study's senior author. In another study published in JACC and presented at ESC Conference 2025, researchers investigated whether the relevance of CH to cardiovascular disease risk diminished as women aged. Given that older adults face the highest cardiovascular disease risk, some earlier studies failed to establish a connection between CH and CVD after age 70. In this study, involving over 6,600 women with a median age of 80 from the Women's Health Initiative Long Life Study, several CH subtypes, TET2, ASXL1, and JACC2, remained associated with incident CVD, indicating that CH continues to impact cardiovascular health even in advanced age. Clonal hematopoiesis is becoming a critical bridge between aging, cardiovascular disease, and cancer, remarked Harlan Krumholtz, MD, FACC, JACC Editor-in-Chief, and Harold H. Hines, Jr. Professor of Medicine at Yale University School of Medicine. This study deepens our comprehension of how inflammation and genetic alterations in blood cells might influence cardiovascular risk, pointing to novel avenues for prevention and therapy.